Hello folks, so I got this question with regards to the NHS in comparison to the free market, and the person asks me somewhat in a patronising manner about, how the free market was something better and more affordable and all the rest of this. Well, the answer's rather quite simple, especially when you talk about American healthcare. The reason why it was far more affordable is because when you go back to a time period before 1913, in fact, if you go back to 1913 alone, in 1913, $1 was worth to the same value of the dollar. In other words, a large part of why things are less affordable today is because of the large devaluation of your currency, and that's one of the reasons. The second reason you have to take into consideration is that if you compare the late 19th century, in other words the 1800s, if you compare that time period to today, they were living in a low inflationary based economy. You compare that to what you're living under today, you're living in a very high inflationary based economy. So people could afford things more. They were able to afford healthcare. They gained immediate access. They had a wide access available for them to get healthcare. So they had immediate service, they had high quality service, they had affordable service, and that's why it was better. However, what I addressed, and it seems that this person chose to ignore my answer. What I said was it would be irrational to compare the 1940s and even 1950s under, when the NHS came to fruition in 1948. It'd be irrational to compare the health of people in the 1950s to what the health of people was like in the 1800s. Because of course people were living better off by the 1950s. There was more medical discovery by then. People were obviously living better off. But what seems to be ignored here is the very fact that between 1760, and this is before the NHS, between 1760 to 1920, the life expectancy had more than doubled, and the population of Great Britain had more than tripled. That's not a sign that people were living worse off. That's not a sign that health was getting worse. That was actually a sign that people's health was improving year in, year out, decade after decade. If that's not evidence, I don't know what is. So when you turn and compare the health of people in the 1950s when the NHS came to fruition, as if to say, oh well, it was government-run healthcare that there was the reason for this. No, people living healthier in the 1950s wasn't because the NHS came to fruition, it's because it was the 1950s. You cannot compare the 1870s to the 1950s. That just doesn't make rational sense. It doesn't make rational sense because, medical discoveries were continuously advancing over that time period of 80 odd years. Of course people were going to be living better off in the 1950s. They were living healthier lifestyles, that the living standards were continuously improving. The more people's, living conditions improve, the healthier people are going to be. It's a bit like seeing the back of the coal industry, because coal is a dirty fuel. People seeing the back of that would see a healthier lifestyle. So people today would be living healthier than people were prior to the 1970s. So all of these things have to be taken into consideration. It's not because, oh wow, government-run healthcare came along and it just all of a sudden, poof, everything was so much better off. If that was the case, and let's just say, for example, the NHS came to existence in the year 1805. It's like saying that, the existence of the NHS automatically made people's health so much better. Well, no, it didn't. It was actually the medical discoveries that continuously made people's lives better off. As we saw from the evidence, the life expectancy more than doubled, and of course the population more than tripled. That didn't happen for nothing. It happened for the simple reason being that at the end of the day, people, the working conditions were improving, the working hours were being reduced, people were just living better standards, living in better standards than they were before. And even if you can, let's just use this for example, if you go back to a time period before the 1800s, when they never had toilet paper, they never had toilets in their houses, etc. And you could see this evidence from Robert Burns' time period. These small things mattered. When you had the luxury of toilets being put into place, toilet paper, etc., etc., all of these things improved your health. It cut out diseases. The medical discoveries helped kill all of that stuff off, even the common malnutrition diseases that people were faced with, such as beriberi, scurvy, and rickets, etc. So that's why people were, living better off by the 20th century. It's not because some government-run healthcare system came around. Now, this is the issue. When you turn your attention to the United States of America, yes, the United States of America prior to 1904, more than 110 years ago, they had a much better healthcare system overall, because it was of a high standard of quality for its time. It was something that could provide immediate service. It was not faced with the massive big long waiting lines. Now this is the thing, because it doesn't matter where you look in socialism. It doesn't matter. I don't care if you're going to sit there and abuse me. I don't care if you call me all the names in the book. I really don't care. I'm only here to sit and tell the truth. And it seems to me people don't like the truth. And the thing is that you go back to a time period before 1904, yes, America had affordable healthcare. The dollar, the purchasing power of their currency, of their money, whilst having the gold standard, was worth a lot of money. They were living better off. They lived in a low inflationary based economy, so they could afford their own health insurance. They could afford their own healthcare. And it was widely accessible. It was affordable. It was of a high standard of quality, and they never had the massive big long waiting lines. Now, like I say, in every socialist regime that you look, you will always find the massive big long waiting lines. You've seen that recently in Venezuela with the massive big long waiting lines just for food. You've seen that in the Soviet Union. It happens because you end up creating surplus waste and shortage problems through government price controls. That's kind of the whole point of why we point out that central planning doesn't work. Socialism doesn't work. It never has, and it never will. And there's no exception with government-run healthcare. What makes you think that just because, it's the NHS, that it's any different? There's no exception. The NHS, whether you like this fact or not, every single year on record, Since 1948, since its inception, every single year on record, it has been faced with massive big long waiting lines. Something that the United States healthcare system never has. And the only reason why it's faced with problems today and you know, a serious shortage problem of medical doctors, it's nothing at all to do with the market. That's the blame on all of the socialist government interventionism through the AMA monopoly, the over-regulation of the private sector, and the third-party payer system. I explained that in the video. But besides the point, the issue here is the fact that the NHS is faced with those massive big long waiting line problems. And every year on record, thousands of people were left in neglect. Now, we would hear the rhetoric about how the NHS, this is the propaganda by the way, the propaganda is that the NHS is available for everyone. Available for everyone. In 2014 alone, more than 60,000 people were left in neglect. Don't bother pulling off an irrational statement and comparing that to United States of America's healthcare today. Of course the United States healthcare today is, you know, neglectful. What do you expect after your socialism drove the prices through the roof? And that's not the fault of capitalism. That is the fault of socialism. Because what you essentially did was you used your socialism to basically close down all those medical schools that forced a reduction in the quantity of medical doctors available on the market, and then you increased the demand. It was engineered. That's the fault of socialism. It's not the fault of the market. So, yes, of course it's neglectful today. But if you were to look at the American healthcare system prior to that, it was very affordable and accessible to thousands, you know, millions across their country. And they lived in, like I said, a low inflationary based economy. Now, you draw the comparison between that and what people are living under today. People live with high costs of living. They live under a system where they've been forced with a fiat paper currency, living in the absence of a gold standard because of the socialists that stripped the gold standard from the currency. And they devalued the currency and they made people worse off. And now you've got what? A debt level that's more than $20 trillion. So, yes, people are living worse off in that regard. Maybe not in living standards, but they're living worse off with regards to their debt problems, with regards to the cost of living. All of those things matter. And this is the point I'm making. Now, like I say, it's really not sensible to compare when the British NHS came to existence to then compare that to a time period when America did have free market healthcare. Why? Just like I said, because the health of people in the 19th century was obviously going to be worse off than the health of people living in the 1950s. I mean, you're talking, you know, near enough 50 plus years in terms of a time difference. Of course people were going to be living better off in terms of their health. It wasn't a case that, oh, along came 1948 and poof, all of a sudden people's health was just better off. No. People's health was continuously improving. It's like if you were to compare the 1760s to the 1840s. People in the 1840s were healthier than the people in 1760. It's just a fact. That's just a simple fact. You know, and that's what I'm getting at. Because if you're going to compare the 1870s and then compare it to 1948, yes, people are going to be living better off. Not because the government came along and basically along came the NHS. That had nothing at all to do with it. Why? Why is it? What makes you believe that government running a healthcare system made people healthier? That is, and I'll let's use this scenario then, right? Let's pretend that none of those medical discoveries came around, right? Let's pretend that none of that came around, and that you never had toilets and you never had toilet paper, and people, and let's just say, for example, we'll use Glasgow for example. Today in Glasgow, you have our water coming from Loch Catherine or Loch Lomond, right? That's where they take the water from, and they've got that filtration system. Let's pretend that if you were to go back to the time period before all of that, before you even had all the water filtration, and essentially you were faced with all of these diseases, you never had all those medical discoveries, and then your NHS came around. Are you honestly trying to tell me that it's because of just government run healthcare that was the reason for why people's health was just, better off? No. People's lives and their health were not better off because of a government run healthcare system. It's just so far off the truth. In fact, it's the opposite of the truth. And I'll tell you why, because when the NHS was, pushed into place in 1948, not only did the costs of healthcare soar out of control, this was all over the news, by the way, this isn't something new, they were always complaining, decade after decade, they were complaining about the costs of healthcare and how they can try and rectify that problem. Well, you want to know why the healthcare costs soar through the roof? Because it's the laws of supply and demand. That's what happens when you've got a supply of doctors and nurses who cannot keep up with the vast demand of a 70 million populated country. What were you expecting? You expecting the amount of people sitting in the NHS to keep up with 70 million people? That's why your healthcare costs soared out of control. It's the laws of supply and demand. It's not something you can argue with. And so you weren't only faced with that problem, you're faced with the very issue of a management problem, the economic calculation problem, the knowledge problem that I've already explained. That government just could not know the information of what to produce more of, how much to produce, where to allocate it. They were faced with the misallocation of valuable scarce resources, and all thanks to government price controls. That's why you ended up with a shortage of hospital beds in the NHS. Now all of these problems were, common. Those problems have been existent. The massive big long waiting lines, the neglect of thousands of people every single year. These problems have been existent for decades. And to give you a prime example, and this is a common problem, to give you a prime example, we saw a 68-year-old man die of a heart attack despite his wife phoning for an ambulance more than 5 times. And the NHS, when investigated by the police, came back and told them that it was because he was on a waiting list. If that's what you think's acceptable, well, there you go. Because I can tell you that right now, that problem does not exist in the United States of America. In the United States, when you've got a problem and you can afford to pay for it, you're given immediate treatment. That's the difference. And the issue with the United States healthcare system today is to do with just to do with the costs. That's not to do with the market. That was to blame on the socialism that you support. So, at the end of the day, like I say, you can patronise me all you want. You can throw all the abuse at me as much as you want. I soon came to realise that wasting my time producing the videos and throwing them up on YouTube was not much value. The reason why it wasn't much value is because there wasn't really that much views getting out of it, and you would come across the type of people such as yourself who are just completely ignorant, and after giving you an answer, a rational answer, you then come back and tell me in your own words that I didn't answer your question. I just did. You came back, you actually came back to me and you said to me that I did not give you an answer, and then you started going on about the 19th century. What I told you was that the British Industrial Revolution time period in Great Britain was not capitalist. I distinctly told you that, and it just seems it just went right past you. You ignored it. I'll say it again. The British Industrial Revolution time period was not a period of free market capitalism. Not when you had the British Corn Laws, not when you had other protectionist tariffs, not when you had government taxation on windows, not when you had so many other problems that in 1843 they imposed the income tax. Now, why did you ignore that? I told you that the government imposed an income tax in 1843, and then I told you that in 1847 the government bombed the British people with high tax rates. You ignored that. Why? Now, I distinctly told you that the imposed high income tax rates on the British people and the crowded out charity in the marketplace with all the government welfare programmes, so that the average people of society could not afford to help the poor. So I'm not really surprised why people living in that time period couldn't afford to do certain things. I'm not really surprised why people were suffering the problems that they were. And of course, there was a higher death rate during that time period rather than 1948. That wasn't because, government-run healthcare came around. No, that's because by 1948 there had been more discovered in terms of medicine to help people, to better people's lives. So it's irrational to compare, after the inception of, the NHS to that of the mid to late 19th century. Because the death rate's obviously going to be higher. You also have to then take into consideration their standards of living, their work conditions. It's a simple fact that people living in the 1950s were living in better luxury than those were in the 1870s. Because of the fact that by the 1950s, the workplace had improved in terms of its conditions. Machinery was continuously improving. It's irrational. You tell me, give me information how government controlling a healthcare system improves people's health. How does government ownership of a healthcare system make people's lives better off? What does it do? What does it do to do so? Are you saying because it's available for everyone? Well, that's not the case. Because I just told you about the massive big long waiting lines that the free market is not faced with. And Britain never had a free market healthcare system. I just told you that the NHS left thousands in neglect, so that contradicts that statement. You tell me how government running a healthcare system makes people's lives better off. How it saves people's lives in terms of how it improves people's health. How does it do that? Does it do it by getting the drugs accessible to them? Because that's quite interesting if you do bring up that argument, and I'll tell you the reason why. Because government actually restricts many life-saving drugs from reaching the marketplace. It's actually the free market that would give you access to that. I can use marijuana for an example of that. That CBD or whatever you call it, oil, cannabis oil, that, you know, saves people's lives, that cures things like Parkinson's, and your government actually restricts the access to that in the marketplace. Isn't that rather quite interesting? So your government actually restricts those things from people getting access to for their health. So I want you to give me a perfectly legitimate answer for how government owning a healthcare system makes people's lives healthier. Because the fact of the matter is, that's not the reason why people were living better off in the 1940s to people living in the 1870s. The reason why people were living better off is because their work conditions were improving, their living standards were improving, their health was improving simply because of the medical discoveries. So, what's that got to do with government? Nothing. Anyway, I'm finished with that rant. It's tiresome, it's boring, and I've pretty much already answered it all. The truth of the matter is, people such as yourself are religiously fixated to the NHS. You treat it as a religion. You've got this emotional attachment to it. You're not interested in fact, reason, logic. And I'll tell you this for sure. The NHS is not more affordable than a free market in healthcare. That evidence is backed up alone by the NHS costing more than £120 billion per year. Now, it's a hidden cost. How you pay for the NHS is through the raised costs of living. If you're trying to tell me that made a healthier population, with people who are forced to pay through their eyeballs through their costs of living having gone up, if you're trying to tell me that made the poor people of society better off by living in a high inflationary based economy, all in the name of paying for your NHS, you're having a laugh. Anyway, I think I've pretty much said enough. Cheers.